Suicide and Forgiveness, the pod that shares the stories of those affected by suicide. Lost a loved one? Attempted it yourself? Did you know that when you share a burden, the load is lightened? Come listen in with your host, Elaine Lindsay.
Suicide Zen Forgiveness, the podcast, is for education only. Some of the subject matter could be triggering for those that are newly grieving or in a poor state of mental health. Please call your local suicide hotline or mental health office if you need immediate help. Hello there. It's good to be back. It's almost the end of winter. Hallelujah. It's something we should all be patting ourselves on the back for being able to have gotten through. Today, I have a guest that we might consider a little bit different from usual. We're going to be talking about grief and loss, chronic illness and pain and trauma. And my guest today is lovely Allyson Byers. Allyson is an associate marriage and family therapist. That's an AMFT in LA. And she's under the supervision of Pam Shaffer. She has a Master of Arts degree from Antioch University in clinical psychology with a specialization in psychological trauma. That really interests me. We're going to have some definite questions about that. She completed her traineeship at D.D. Hirsch Jump Street, a crisis residential treatment program in Los Angeles, where she worked with adult clients with severe mental health issues, including major depression, complex trauma, suicidal thoughts, borderline personality disorder, substance use issues, severe anxiety, and psychosis. This means that she really has a wide swath that she'll be able to discuss with us and take a good look at. And what I think is really, really cool, okay? Allyson is a queer therapist who has chronic illness. And from that, she draws from her professional and her lived experiences. And for me, I think it's really important because I'm forever saying, if you're going to do something, if you're going to work with humans, you really need to sit in their place for a little bit so that you can truly understand what it's all about. Without further ado, I want to bring Allyson out.
Hi.
Hello there.
Hey.
It's very good to have you with me today.
Thank you. It's great to be here.
Good. I'm sure you have better weather than me.
Yes, it is. It is very nice here.
Yeah, LA definitely for the most part, I would say you have way better weather. We're still snowing here, so I'm really probably more excited about spring than most people.
Fair. Understand that.
Yeah. So what I want to do, and I like to really just make a conversation. So let's look at, I want to ask you, what came first? Your training or your illness?
My illness came first. I was first diagnosed with a condition called, it's a mouthful, hidradenitis suppurativa. It's a skin disease that results in like abscesses all over the body. Yeah, it's very painful. I was diagnosed my senior year of college, so I was just finishing up school, ready to like go into the real world and do everything that I was learning. I was a journalism major, and so I wanted to go be a broadcast reporter. And just I realized I was doing an internship and I couldn't carry the camera equipment. I had just a hard time working those long hours. And so I took some time off, moved back home with my parents, and just kind of reevaluated things.
Oh, that had to be so tough, because it's just your introduction to the whole wide world as an adult. Oh my God.
Yeah.
Just
Yeah.
the mind games that we play with ourselves, that had to be quite the burden.
Yeah, yeah, I went to a pretty dark place.
Mm.
And I had struggled with depression for through my teenage years and for a long time, but it was kind of then when I really started first having some suicidal thoughts and some really tough dark thoughts about just the future and what life held for me.
Yeah, and you know, I like to always stress it's very often not that we don't want to live anymore. It's that we don't want to be in pain anymore, whatever kind of pain that
Yes.
be. And from that place, did you reach out at home? Did you reach out to a therapist? What was it that gave you the impetus to basically put a hand out and ask for help?
Yeah, so I actually therapy is not I'm from the Midwest, from Wisconsin. Therapy is still not a thing there.
Mhm.
And
Yeah.
so yeah, yeah, so it's really kind of like, my parents were very supportive, but they kind of were like, "All right, you got to find a new career path. We got to find something else that's gonna." So it's kind of wild. I moved to Chicago with some friends, just kind of worked and tried to see doctors in Chicago and try and just get some good medical treatment for my illnesses. And then I've always wanted to live in California, in Los Angeles, and so I just packed my bags and I moved out here. I figured, like, what do I have to lose? And the weather's great, and maybe it would have helped my illnesses. They had a really great specialty clinic out here for hydronitis. So I just kind of packed my bags and decided to try it in the entertainment industry. And looking back, I'm like,
Wow.
I went to go to an industry where there's insane working hours, but I was like, I just can't live like this anymore, and I can't live without doing anything. And then
Oh,
it's here. When I got here, this is like when I found a therapist, because everyone in LA sees a therapist, and so
aha, got it. And I do find, as someone that's dealt with chronic illness, we can't do things all the time, but it's amazing how much you can do when it's something you really, really want. And
Yeah.
it's not always the best thing you can do for yourself, is it? When you push
Yeah.
yourself too hard, that can be a real issue too.
Yes. Yes. I have burned out of jobs. I mean, I've left many
Yeah,
jobs because of just getting too sick, um and I think yeah, something I also really learned is having doctors and a team that really supports you and is there to, like, have ideas with treatments, and just that opens the doors to have a medical team too that can really, like, help with treatment options, and is just there. I have a great team too that's just really supportive of the mental health aspects too of it, and understands that there is I mean, it affects your mental health and vice versa.
absolutely, absolutely. Like everything in our bodies, it's truly integrated. You know,
Yeah.
if you have a pain somewhere, it is going to affect other areas of your body, and quite often, pain shows up in other places from where the problem actually is.
Yep. Yeah.
So you found yourself a therapist, and did was the first one a good fit?
Yes, yes. She was a really good fit, for a long time. And then, um, things got yeah, it ended up not being a good fit after about 4 years. And then I found someone new who is now a really wonderful fit, and, but yeah, I mean, it was that first therapist that um, really inspired me to go back to school and become a therapist myself. It was that
Oh,
experience that
wow.
inspired me to do the same. So I had to give her credit for that.
Oh, absolutely. And what a detour from journalism,
Yeah.
rather than, yeah, rather than being the one, well, actually, in some funny ways, it's not actually. It's just a little more specific, right? Because you're looking at the stories of others. You're just, you're no longer just recording them. You're actually working with them. I don't have a better term, but you're working with the individual to change the story. As a reporter, you're just the facts.
Yeah, yeah, and I'm able to sit with people now and sit with people in their pain, and I actually have kind of a full circle. I was doing an internship in, yeah, it was my senior year of college. It was in a small town in Wisconsin, and, there had been this, like, awful car crash that had happened, and I was sent out to go report on it, and it's kind of my big story. It was supposed to be, like, kind of the big the big story that I've been waiting for my entire internship, and I got there and I just, there were fatalities and I just didn't want to stick a camera in their face and ask them, how are you doing? Of course it was pretty obvious like how they were feeling. And I came back with like no footage and I got in huge trouble. And it was kind of like a wake up call though, of like, this is not, I don't know if this is actually what I want to do either. There's something missing here. And then, finding therapy, I was like, this is what's missing. I get to actually sit with those people and be in their pain. I'm not trying to fix it. I'm not trying to come up with solutions, but just sitting there and witnessing their stories is just something that was a missing moment that I've been just found now.
Well, absolutely. And that's exactly what I want to do here because sharing your story lightens your burden and it really, really does. And that,
Yes.
yeah, therapy, I think, is just a much deeper, bigger version of that.
Yeah.
I also think perhaps you were a little too empathetic to just be a reporter. And I don't mean that I'm not in any way denigrating reporters because they are critical to us, but you have to be able to build a certain distance between yourself as a reporter and the people that are in crisis. Um, you couldn't do it for long if you didn't. I just think it's unfortunate when you see a lot of reporters, those first couple of questions are often so inane. It's like, oh, come on, you see what's going on. Give the viewer something to be more empathetic about.
Yeah.
But I mean, that's we could do a whole show just on that.
Yeah. Yeah. And it's interesting though, something I've learned is just starting out as a trauma therapist, especially, is like how to, in this line of work too, how to be there with the client and listen to their story and really be there, but also not have it like overtake me where then I can't, like, I'm getting vicarious trauma, which is like I'm starting to carry their stories or I'm starting to find, and again, it's like kind of this, don't want to not detach, is not, that's a very like clinical, I don't, not detach,
Yeah,
but like just be in there, but also kind of step back then and also be able to go home and take care of myself and come back, and so I can do the work for a long time and not get overloaded with things as well, because I hear some
yeah,
pretty awful stories.
it's like giving yourself a little breathing room so
Yeah,
that you
yeah,
can be of service.
yeah. It's hard when this work. I mean, you doing this podcast. It's hard to be in this work all the time and
Yeah,
continue to pour from your cup.
absolutely. And I think in a way, and I don't know if you agree, but being chronically ill and living in pain 24/7, it gives you a better opportunity to carry your empathy with you and still be of service because after the fact or late in your journey, you're able to understand that you have to give yourself that breathing room in order to be of any use to anyone else.
Yeah, definitely agree.
It's it's incredible the work you do. And again, I was talking to you before we came on. I think it's incredibly important for therapists, for doctors, for nurses, dentists, anyone that has the ability to inflict pain, not intentionally, needs to understand what it is on the other side so that they can be mindful when they're working with people. Because I don't know how much time you spent in hospital or being tested or what have you. It can become very, the people can become guinea pigs, and I don't want to say guinea pig because they have feelings too, but for young residents and teaching students in the medical field, they can lose sight of the fact that this person before you is a person. They're not just your test subject. And that, I think, is something that we don't spend enough time educating on. And I don't know what it's like in the therapy field, but I think empathy is something that we have to explore if we're going to work with other human beings.
Yeah, something, it's a couple of things that come to mind is one is I'm really passionate actually about working with people with medical trauma. And I think we think of medical trauma as this like big, like had a life-threatening surgery, or, they messed up on something, and those of course are traumas, but also just these kind of more, I don't like to say little traumas, that's minimizing, but these more chronic traumas of like being dismissed by doctors, being just poked and prodded and not looked at as human, fat phobia, like going to doctors that are harmful or therapists that are harmful. Like, I was harmed by a therapist like very intensely, and like it now affects, I work with clients who have been harmed by other mental health professionals or hospitalizations, especially psychiatric hospitalizations that are like, yes, maybe your life was saved, but also it caused a lot of trauma, and just these institutions that can be harmful and can cause trauma. There is a big passion of mine.
I'm really glad to hear that, because it is almost in those little things. And they're not little for the person that's suffering through it, but for someone to go to a doctor because they deep inside know there's something wrong, and be consistently told, nah, just go home.
Mm-hmm.
Or not just fat phobia, but there are so many ways. Oh, good, it wasn't mine.
No, it is mine. I have a little dog.
Yeah, me too, tiny. The concept of being dismissed, it speaks to humans' deepest need to be seen and heard. And when you're already in pain, even if it's mental pain, that can be kind of the last straw when they just don't take you seriously. And it's not even a matter of getting gaslighted. It's a matter of beginning to doubt oneself. And the more it happens, the more doubt there is. And I know that can contribute to the statistics that I deal with all the time here. But it's got to be a really big part for a therapist to have, patients that have been basically, poo-pooed away, or, oh yeah, that's not a big deal. Or in the case of trauma and chronic illness is, oh yeah, just buck up, suffer through it. There are people worse than you. That kind of dismissive attitude, sadly, is still out there.
Yeah.
And
definitely.
in terms of patients, it's hard to generalize, I get that, but in terms of standing up for oneself, whether it's medical or an authority or a family member or someone who is not taking your concerns or your pain or whatever seriously, what are some sort of general things that people can do to protect themselves within those interactions?
Yeah, this is a tough one. I would say, setting boundaries is a big thing of like, I will not have conversations about this, or this is, we're not talking about this. I always give clients too, I'm like, here's some, if they want to educate themselves on something more, then here's, have a list of educational, like what it's like living with depression or whatever it may be. And, say, this is how you can, if you want to read about this, if it's someone who truly does care and wants to understand, but just isn't getting it, because it's hard to provide that emotional labor of, explaining to someone what it's like living with your whatever physical or mental illness. And also just I think community is so important, like, whether it's in the chronic illness, whether it's mental or physical, it's finding community and online people who just can get it, other people who live with chronic illness. My social media feeds now are just filled with either therapists or people living with like chronic illness or people with lived experience in different areas. And just just seeing those, just seeing those videos and photos just reminds me of like other people are going through this. And there's also some really great Facebook groups for every type of illness out there, and so it's like joining those groups. People are just, even people will join and say like, hey, I'm not sure if I have this, I'm not getting this diagnosis, but this is what I'm experiencing. And just that validation, even if you aren't able, if you're still trying to get that diagnosis, can be so helpful. I think just community is so important with any of these things. Just having a sense of community is so, so important.
Yeah, we all need a tribe. We all need a tribe.
Yes.
I don't know. Are you, I'm finding in the past, I'm going to say 6 or 7 years, there are more people that are more open to learning about the chronic illnesses, to learning about mental health issues that people deal with on a day-to-day basis, way more so than ever before. People used to be quite dismissive, and not just within a workplace or management or what have you. Leadership still needs to go a long, long way, especially in the corporate world. But people and more young men as well are starting to understand that you can't just keep it inside. You need to talk to someone else, whatever your issue may be. And are you seeing like more younger people coming for help?
Yeah, definitely. I think it's a lot more. It's hard because I know living in Los Angeles, it's already so much more open here than other places. So I sometimes I feel like I live in a bubble a little bit where it is so talked about here. But even going back to, when I go back home to Wisconsin, like, I've, friends from home or family members who are going to therapy who I never thought in a million years would ever go talk to somebody. And so I think it is getting better. And I know in like the mental health world, there is conversations around like, TikTok and Instagram and like if they're helpful or if people are over-diagnosing themselves or over-identifying things. And I'm just like, access is hard to get sometimes to a therapist. And so if people are finding that like able to look at something and go like, wow, I have those similar symptoms, or I relate to this a lot, and maybe this is something that's going on, it gets them to go reach out for help. I'm all for that. And I think it's, we can, and I even think us being out there on social media too and providing psychoeducational content on this stuff too is helping people realize like, don't have to live in shame with this. I can go talk to somebody. And so I'm really passionate about some of those. I feel like suicidal thoughts and suicidality is something that a lot of therapists still really shy away from. And I'm like, we have to talk about these things. Borderline personality disorder is a very stigmatized diagnosis that, comes from inside the community too, but it's so important to talk about these things.
Absolutely. And with it being International Women's Month and this being the week or last week, I was at a number of events, and they're all to do with mental health. one in particular for the main psychiatric hospital here in town was Every Woman Counts. And it had to do with mental health, and a lot of women in the community came together and created a group for women's mental health. And they have a foundation and they do all kinds of work, which is phenomenal because it makes a huge difference. And it's so touching to see millennials and the younger people understanding that it's not just about you alone. Like, you have to get together with others and you have to try and uplift others. And it was very different when I was young. The stigma was prevalent, maybe way more prevalent than it is now. I did volunteer work in a facility. It wasn't psychiatric. It was for people that were mentally challenged. And it became sort of the last ditch drop-off point for anything from someone who didn't have any family to someone who had a mental deficit to, in one case, a young boy who was a runaway. And he was a runaway because his home was abusive. And he'd run away so many times. I was working for a summer there, and I came upon him in one of the wings. It was a giant place. And I said, "Oh, wow, you're working here too?" And he said, "No, I live here now." And it literally put me in a state of total fear, because in my head, you could be put away for anything. So if you had a suicidal thought, or even a thought that maybe you thought was a little crazy, you better not put it out there, because that's where you were going to end up. And it just made the silence and the stigma and that shame this huge rolling boulder that took on its own life. And I talked to other people from that year, friends from school, and they all basically said the same thing. "Oh, yeah, that was, you didn't dare say that." Our parents came from, you don't air your dirty laundry in public. You don't say anything. My aunt, my father's only sister, was abused by her husband. Mm-hmm. And it was not well known. She died when I was 7. And we didn't know how she died, or to this day, we're still not quite sure. I know it was not an easy or an expected death, because she was not very old.
Yeah.
But when I talk to people, they all have similar stories. You don't talk about that. You didn't put that out there. "Oh, our family didn't discuss X, Y, Z." And there were people who were in the medical field. I have friends that are therapists, but it was not something that you trumpeted. And one therapist that I spoke to the other day, she was saying that it used to be funny because when you saw a patient in public, you had to avert your eyes and certainly not pretend that you knew them. And lately, she had seen a couple of patients who were waving and "Hi, that's my therapist." It's just such a different attitude, and that openness. I want to see us permeate everything to do with mental health and suicidal ideation and all of those things. And I want to ask you, what do you think about getting the information to children, young children? I think if you're in elementary school, you need to understand that every thought that runs through your head is not real, nor is it right, nor does it reflect on you as a person.
Yeah, yeah. Yeah, it's interesting. My mom's a elementary school teacher, and we have conversations a lot about mental health, and it's like kids will say something, and like, this day was so hard, I just want to kill myself. And then it's like,
Yeah.
My mom has to like make her call, make her report, and this whole big thing happens. And it's like, I'm sure, it sends a message of like, if you say this, we're gonna have this whole big
Yeah.
thing has to happen. And I was like, I wish there was more conversations around, and they'd still just have like, the like they don't have conversations about anxiety and
No,
depression. I think about like
no.
growing up with anxiety, it was looked at as like, yay, you want to do so good in school. And it was like, no, I was paralyzed inside with just
Yes.
fear. And like, I wish there was just more conversations around these things, or like, hey, what do you mean when you say you're having a really bad day, you want to kill yourself? What's going on here? Like, what
Yeah.
are the emotions underneath? And it's like, and then they make these calls and everyone comes and then nothing happens, nothing gets followed up on. And then, the
Yeah.
kid's still suffering. There's something going on where they're saying that. And yeah, just depression too. My mom and I talk a lot about just that kids are suffering, and they're like,
Yeah.
they're not able to have places to talk. And especially I think, in California here, I think more parents are more willing to, I work with some
Yeah.
teens, they're more willing to
Yeah.
put kids in some, but like still outside of the big cities, I think that's not really happening as
No,
much. And
no. And
it's
you're seeing children getting bullied as young as 9 and
yeah,
10. And
yeah.
it's not outside the realm. Children have died. We
Mhm.
don't see it as much because the families are still covering it up. Okay, I
Yeah.
mean, it's a horrible thought. Um, I don't know if it was last week. I don't remember what I was seeing. They were interviewing some celebrities or something. I just happened to catch the tail end of whatever was being said, and the one of the women said, "Oh, I could just kill myself. That was such a blah blah blah," and it was something very trivial. And I thought, that's not that's not a statement we should use. It's
Mhm.
not something we want to put out there, and it's definitely not something we want celebrities putting out there because children still follow the crowd. They still want to be like their heroes and sheroes and what have you. And I think it's important. I believe comedy solves a number of things and keeps us all going. And I'm not saying you can't say anything. What I'm saying is we need to open conversation early enough that even children will understand someone was making a joke. It's not a good joke. It's not a good thing to say, but it's not meant. It's not something you should act upon, or if you have that kind of thought, it's not something that you should be following. You should tell someone, not, just throw it out there. I don't have I don't have a roadmap for what I'm suggesting. And I'm probably going to talk to everybody on the planet if I can, because somebody needs to start the chat wherever you are, and let's move it along so that we can save more people.
Yeah. Yeah, it's really interesting. I did for part of my traineeship, we had to do go to a local like boys and girls club, and we talked to them about we did different presentations for the different age ranges, and we talked about like emotions and how to regulate your emotions, what to do when you're angry. And it was amazing. This yeah, local boys and girls club put on mental health presentations every
Mhm.
month for the kids. And yeah, and they had their little toolbox, and we like helped them build new tools around like, when you're angry, you don't go and punch somebody, or how do you use your words? How do you tell somebody? How do you express what you're feeling? And It was so great, and I wish that existed for every kid to be able to get those tools and get that conversation. They were interested. They wanted to learn and understand and like
Yeah.
play, learn this stuff. And a lot of them had some really like big feelings that were happening, like especially in this area, it was low income, and
Oh,
like their
yeah.
parents, their
Yeah.
parents had never learned how to like regulate their emotions. And so they were like, I don't know what to do with this. And kids are, I mean, I couldn't imagine. I mean, I grew up like with a little bit of social media, but I cannot imagine even today, like growing up with like all the stuff on social media, and like
Yeah.
there's a lot of great things social media does, but also for kids, it's like I can just not just all the
I
filters and
can't.
all the
Yeah.
like,
I can't
yeah,
even imagine had there been
yeah,
social media when my crew were in school. Oh,
yeah, and
God.
the bullying and
Oh my
cyberbullying,
God. Yeah,
yeah,
it's truly frightening. And
yeah,
for kids, I think this is wonderful. And a lot of the tools are virtual. Okay, mindfulness and little
yeah,
meditations and visualizations that can help you bring those emotions down. Because yeah, emotions are terrifying. Okay,
yeah,
even at the ripe old age of 67, there are some emotions that come and it's like, oh my God, what do I do with that? And
yeah,
yeah, we've never had a way to deal with those things. School is great for learning to interact with others, but we don't teach the basic, most important things that we as humans need to learn.
yeah,
Yes, I'm not knocking geography and history, and all of those things are definitely important. But how about, the basics for little kids of how to handle your emotions, how to handle problems with your parents? There's a
yeah,
lot of kids, we don't see what's going on in their homes. And
yeah,
if you're a kid and that's all you think that's normal. And sorry, I
yeah,
hate that word normal, but you think that's the regular activity in most households
yes,
because no
yeah,
one, yeah, yeah,
exactly. Yeah. I have so many adult clients who come and they just feel so ashamed of like how they have operated or how things have been, and they feel like I'm broke. I hear so much like I'm broken, my brain is broken. I am like not why am I not functioning at the level other people are functioning? And first of all, we talk about like what does that mean? What does normal functioning really look like? It's the
yeah,
first conversation, but also it's like, hey, you didn't learn these things. Like these are learned skills and you
yeah.
didn't learn them, or you got messaging that like, a lot of my clients get messaging of like I was not allowed to feel emotions. Like that was not
Oh, yeah.
something like expressing anger, feeling sad. Like you put that away. Kind of you said earlier too. Like you don't air your dirty laundry. You don't feel these. You
No,
power
no.
through and you move forward. And so a lot of them don't even know how to. We work. I'll bring out like a feelings wheel, and some are just so overwhelmed with like all the feelings on the feelings wheel, and we'll just
Yeah,
sometimes spend time talking about them. And every session I start off with they have to pick two emotions from the feelings wheel, and they can't say I'm good, I'm fine, I'm okay. It has to pick something from there, and we just start learning
love that.
how to identify emotions. And something I think I'm other therapists maybe are not like this necessarily, but I'm a little bit more like I self-disclose a little more. Like I'll also pick my feelings off the feelings wheel and go like, hey, I'm having a hard day, but I did this, coping tool and I'm
Yeah,
here now. I'm excited to be here with you and we're gonna, do some work. But I also don't use like I'm good or I'm okay or I'm
yeah.
fine. I really try and, stay away from those things too, because they're not really how we feel.
Well, no, it's such a band-aid.
Yeah.
Instead of saying I'm fine, or just hand somebody a band-aid because that's about what you do.
Yeah, yeah, and a lot of clients too, like, a lot of people never really get I mean, we always ask, "How are you?" to people, right? But we don't really care I mean, a lot of people don't necessarily care
We
what
don't
the
even wait for the answer.
Yeah,
Yeah,
exactly. So it's like a lot of clients find when they come, they're like, "Oh, someone wants to know how I am," and they actually care what the answer is and why, and, that's
yeah.
new for some people.
And that what you offer, that be letting them be seen and be heard, I think that's the greatest gift in the world. And if we could just learn to do that from the get-go for the
Yes.
children, it would be a lot easier. But
Yeah.
we don't come with a handbook. Okay?
Mm-hmm.
None of us did. And no, none of us are perfect. And I, part of my little crusade here, and none of us are normal. Okay? We might be regular, we might kind of fit in, but no, I want to be Abby normal. I want to be me. Because
Yeah.
if everybody was exactly the same, why would there be an everybody?
Yeah.
that just makes no sense to me. It's like,
Yeah.
no, there's got to be color, flavor. Would you eat the same square piece of nothingness day in and day out if it had no flavor?
Yeah.
No. How would you get a kid to eat that? There's just no way.
Yeah.
So why do we want to be bland or flavorless? I think it's important. And I think it's important for us to understand that everybody, I don't care who they are, I don't care how disabled they are, I don't care how gifted they may be, everybody has one thing that they do spectacularly. One thing that they can hold as their own little special thing. And I think it's important, and I always told my kids it was important to understand that although you can, in the case of my son, was fabulous at math as a little kid, and his sister was not. And she was 9 years older than him. And he was being very mean to her one day. And I said, listen, you, okay, this is how it is. And everybody has a talent. And your sister is an artist. And you can't draw a stick figure. So do you want her to make fun of you about that? He was a bit of a precocious child, so did not like that. But I think it's important for people to understand that, yeah, just because we don't do it the same way, just because you and I don't part our hair on the same side or wear the same color, it doesn't mean we don't have all the same feelings. We don't have all the same internal bits that keep us chugging along. So those similarities are there, I think, to support the differences. So we can find others interesting.
Yeah. Yeah. Such a good point.
And so I'll get off my soapbox.
I love it.
You're
Make such good points.
You're very easy to talk to.
Thank you.
I think it's incredibly important. I think it's wonderful that you recognize that you're in LA, so you have a much more open group of people that understand how important these things are. How do we get that to permeate through the small towns and all the little places so that people understand? It's an old adage, but it really does take a village.
Yeah. Yeah. I mean, even it's so interesting. Even my mom, who she knows, I mean, we talk very openly about my career and like she knows all about therapy and stuff. Even she went through breast cancer, and even like during it, I was like, you should really see a therapist. Like, this is a really big thing to be going through. And she was like, I don't want to talk about my childhood. And I was like, no one's gonna make you talk about your childhood. You can go and just talk present. I was like,
Yeah.
we're not, like, us therapists are not like, and if someone's going to try and force you to talk about your childhood and you don't want to,
Get
go find
another
another
therapist.
Go find someone else. But I was just like, you are in control of what you can talk and not talk about. It's okay. Like, And so just a very like, yeah, it's still this idea of like, oh, a therapist is gonna make me go back and talk about my childhood, and they're gonna say all my problems are because of childhood. And it's like, I wish there was more education around like there's so many different types of therapy. There's so many different types of therapists. Like there's so many, you can go for short-term things just for, if you're just going through a difficult time. And I think too, there's a lot of times people feel like, well, I'm going to be in therapy forever. And it's like, no, most people come. I mean, I have some clients who after 6 months or even a few months, they're okay. They're ready to go back, and they may come back once a month for maintenance sessions, or they may come back, when things get, difficult again, but you're not stuck doing this forever. And I think too, it's hard because there's like, which I'll keep brief because I can go into a whole soapbox on this of like accessibility, therapists have to be, I think a lot of people don't also understand some of the intricacies of like, we have to be licensed in the state we live in. So there's like just a lack of, in LA alone, there's, thousands of therapists. There's so many of us. It's a very saturated environment. But in like, I look at Wisconsin, there's not as many therapists. In the rural areas, I hope telehealth is helping things a lot, being able to see clients throughout the state. But even still, I think there's just a lot of therapists don't live in some states, and they're kind of, there's a ton in California, and there's a lot of clients here, but I'm hoping too, they're working on legislation to allow for therapists to get more easily licensed in other states. Or if a client, because even if one of my clients travels for just a couple weeks, like I cannot see them while they're traveling, which feels, they have to be physically in California. So there's just a lot of, I didn't
know that.
Yeah, some therapists will do it, but it technically is not. It's and so it's hard. And sometimes my clients are traveling, that's when they're going back to family. They're going. They're going to some big things are gonna come up, and so it's hard. So I'm hoping that they start to pass these more laws where you can be easily licensed in other states, or you can see clients throughout if they're traveling. But there's just a lot, and I think too, accessibility in terms of like insurance. It's really hard. I don't take insurance, partially because my supervisor does not take insurance. But we have these conversations a lot where it's like reimbursement is really low for insurance companies, and you spend hours unpaid every week trying to get paid, trying to get those claims and stuff. And then also like they have to, I have some clients who are coming they're not necessarily have like diagnosable things. They're just coming because they're having some relationship difficulties or things like that. And insurance won't cover that. And then I have to try and like make up or try and like fit them in some diagnosis, which feels really, so it's, there's just a lot of that too. And insurance companies really prioritize like big therapy groups. And so like us little like sole like private practice people have a hard time. Sometimes takes like 6 months to a year to even get paneled with insurance. So even if I want to take it, I have to like wait a very long time. So that's a lot. Easy. Yeah. It's not as simple as like, I'll just take insurance. There's a lot that goes into it too, and looking at it. And I wish it was more like, for me, when I get licensed, I plan to have a few like very low income slots for people who, for $20 or that sort of thing too. And it's hard being an associate as well. It's 50% of my income goes to my supervisor. So she takes 50% of my fees for giving me, I work under her license, and, this is very standard. Like this is a very standard rate. But it's hard. Like I can't charge, if I charge $20, I'm like going to get $10.
That's not going to work.
Yes, there's a lot of that goes in that conversation too, around just accessibility and needing to have a big change in our
policies
too.
Another thing that for me, just as a layperson who kind of looking at the big picture, I would like us to change to a proactive system for health and wellness, and mental health has to be part of that. Because if you, and that's why I started with like having the children understand and the silence. Well, also, if you're not quite sure how you're feeling, if you nip it in the bud, or if you already have seen a therapist who's given you tools just to live your life with, you may not have to go see them for something horrific because you were armed with the tools you needed. And I think the same for health. We've always been backwards in the Western world. You don't go to the doctor until your arm's falling off, or some cases, many things are falling off. We don't do that. It's not prevention. And it's proven in the other countries that start with prevention, on average, the health costs are an awful lot less.
Yeah.
Because, you're not getting so far gone that you need extreme measures.
Yes. Yeah. Especially, yeah. Definitely. Or even with trauma too. It's like, I definitely I'm passionate about in the future. I want to volunteer for the Red Cross and go to like disaster zones, because a lot of that is like trying to just kind of nip it in the bud with people right away of like, here's some coping tools. And a lot of people they'll be okay. Like they will use their tools. They'll go through hard time, but they will be okay. And when it's like really trying to get there and give education around like, these are signs, these are things to look out for. I wish we did that more of just, I talk a lot in my groups that I run at, like I work at a treatment center. We talk a lot about like, what are warning signs for depression? What are signs that like maybe your depression or anxiety or like, bipolar disorder is getting worse? What are you going to do when that happens? Like who are you going to reach out to? What's going to be, and just a lot of conversations around preventing it from getting to like a crisis level where then it's, and I feel for people who are in crisis and they're trying to find a therapist and can't find someone, or there's wait lists. Like it's just really, but I understand people don't want to pay for this stuff if nothing's going wrong yet. And I understand that that's a thing, but I wish we were.
You pay insurance. You pay health insurance. You pay car insurance. You pay house insurance. Why don't you pay yourself insurance? We do it for our pets.
Yeah.
And putting together in what you were saying there, having a plan. Okay, just as a person, not because you have an issue, but just having a plan in the event that something happens. Here are some tools, and everybody now, I believe, has heard of meditation and visualization. Those are tools that it's easy to arm ourselves with, and they don't cost anything. But having putting together, for me, I think it starts with even the people that are coming into the same countries as us. I was an immigrant. We came with what we had on our back and one little box of dishes. That the train, when we got to this country, the guy running the train said to my father, "Oh, that can't come on the train. It says fragile." And my dad said, "Oh, just give me a minute." And he went and got him a pen and scratched out fragile because it was all we had. Luckily, they made it here. But if we had a little booklet or something that maybe we give to kids as they start school and start them on a path to understanding, here are the emotions we have. Here's what you can do with them. Look in your little plan. And for little kids, it could just be pictures about kids are very open to meditation and visualization. They have imaginations that are wonderful. But I think it's a really good idea to start something so that people have a reference guide. When I grew up, we had encyclopedias, like tons of them. We have the internet for the most part, but having something that's intrinsically about you, for you, and is there to keep you well, I think is really important. And that was a really good suggestion. That was an excellent suggestion, Allyson. I love that.
Yeah, I know. It even got me thinking on this right now, talking of like some kind of even workshop for low fee workshop for people to come and like, hey, maybe you're not, maybe you're doing pretty good, but if like
Yes.
something to kind of prep for what if, we're going to go through grief, we're going to go through hard times, things are going to happen. Like
Yeah.
life is going to become difficult, and how are you going to get through that, or how are you going to move through that? So I think that's, I remember there's a therapist, actually. I went to a local a friend went to a local neighborhood kind of festival thing, and she said there was a therapist there who had a booth at the festival, and she just like, people could sign up just to talk to her for 10-15 minutes and learn about what is therapy, what do you do, and like she would just give some like resources, and was there just to kind of like destigmatize like therapy and what it was all about. And it was a more lower income community, and so it was probably people who hadn't really thought about therapy. And I was like, that's such a cool idea to go into the community and
I think that's brilliant.
Yeah.
Well, just think about it. Okay. If you go to buy a wedding dress, they have little booklets for how you get a wedding planner, how you set up the tables, how you send invitation. There's a how-to for so many things. Why don't we make a how-to for us?
Yeah.
How to be. This is good.
Yeah.
It's way down the road, and if this conversation sparks something somewhere, I think it would be wonderful, because I firmly believe every bit of knowledge that you can arm yourself with is vital in making sure that you can live your happiest life, because happiness isn't something that smacks you in the head. It's something you have to work on.
Yes.
Yeah. And it's not up to the people around us. It's not up to our therapists. It's not up to our rabbis or priests or padres or pastors or what have you. It is up to you to make that choice.
Yeah. It's interesting because I'm very much like, I'm self-disclosed to clients more than probably other therapists do, because I really value, I think sharing myself is like, we're two humans in a room. Like, yes, I'm a therapist, but we are two humans in a room. And I really, especially someone who's, I'm someone who is very open about my chronic suicide ideation. Like, I have had suicidal thoughts on and off for 16 years, and there's something I just have kind of to live with. Yeah, they probably will be around for a long time. I think a lot of people think like, oh, you're a therapist, you must, you don't struggle with this stuff, you're happy all the time. Like, nope, I struggle with this all the time. But now they're blips that come in, and I'm able to like manage them and have a plan, and they kind of come and go. And but I'm like, I still have moments of joy and happiness and all these, more positive emotions, but also I have hard days. We have hard days. And sometimes I think, people think mental wellness is being happy all the time. And something we talk about at our treatment center is like really educating people on like, just like physical health. You're going to have like pain. You're going to have, difficult, challenging emotions. You're going to have periods of time where things just are tough, and that's okay. It doesn't mean there's something wrong with you. It's part of life. But learning how to cope with that is important.
And part of that is the fact that humans by nature are comparative. So we can't know that we're happy unless we've been sad.
Yeah.
You don't know somebody's tall unless you've seen someone who's short. That would be me. We are comparative in everything. It is human nature.
Yeah,
so,
such a good point.
Going through all of those emotions, the one thing that we need to understand is that emotions are meant to flow and go. They're passing. Okay. And I think the longest I've heard now is 3 minutes. The average emotion lasts 90 seconds to 3 minutes.
Yeah.
Once you know, that's another tool for your toolbox. Because if you can make it through those 3 minutes or 90 seconds, then you can move on to a better emotion. And it won't always be happiness, but you have the choice to kind of move it up the scale towards something better, no matter what's going on. And I will hearken back to Viktor Frankl in that, because if you can find happiness in a concentration camp because it's your choice, then we surely should be able to do a little something ourselves if we have those guides.
Yeah. Yeah. I talk a lot about with the clients, I talk a lot about small wins. I'm like, just looking throughout your day of like, hey, you got out of bed this morning, even though depression wanted you to stay in bed all day. Great. You made it to the couch. Awesome. That is a win. Like, you got out of bed for 30 minutes and then went back in it. All right. You got out of bed for 30 minutes.
You got out. Yep.
Really, really reminding clients too of like these moments of joy, or I call them pockets of joy too, or pockets of okayness, they're gonna be really little when you're really battling like, severe depression or severe anxiety, but they're there. Like, that's still reminders that like the depression lets up for a little bit, just for a second, and comes back, but they're there no matter what. And we have to just like hold on to those little moments and accept that like we're gonna get out of this and this is gonna get better at some point.
And if you can write them down, it gives you something to go back and go over and realize, well, okay, I thought, Monday was really, really bad, but oh, look at all these little bits of joy, as you say. So it wasn't as bad as I thought.
Yeah. Yeah.
And every little bit helps, right? Every little thing that you can do.
Yep. Yeah.
All right. Well, we've just made everything right with the world.
There we go.
How do we get that out there?
Someone do this plan, because I have too many ideas and not enough time for plans. So
well, yeah, but they're really good ideas. And the fact is that we're kind of being a little flip about this, but someone somewhere may see this and somebody else may run with it. And, all the good ideas eventually come to fruition.
Yes.
So for me, I think that's a big win.
Yes. Yeah.
And as much as some may think we were a little off topic today, I think it was right on cue for where it needed to be and why. And it's, for me, one more step in my quest to end the silence, the stigma, and the shame. Yeah. I thank you so much, Allyson, for coming on and really giving so much of yourself. I appreciate that.
Thank you for having me.
If you had one thing to offer the audience, one thing that you think is a useful tip or a little tool that they can put in their own toolbox, what would that be?
Practicing radical acceptance, I think, is a really big thing. Radically accepting, this is where, you know what, right now I am feeling really sad, and that is okay. And maybe I always tell clients, even with suicide, let's even do it suicidal thoughts, like having suicidal thoughts right now. I tell clients sometimes, I'm like, push it off till tomorrow. Wake up tomorrow and see how you feel. And you may feel differently in the morning. And a lot of times people wake up in the next morning and they go, oh, I'm actually like, I feel a little better, or this feels a little different, or it's just not as strong. And it's just like accepting where we are is the only way we can make change and find hope and opportunity for something to be just a little bit different, which I love.
That's wonderful, because you walked right into something that I've been doing for a very long time. When you take a nap or go to bed and go to sleep, those first 10 to 15 seconds when you wake up, you're a blank slate. You can write anything on that slate. You have the opportunity to start that next day or hour or whatever it is in the way that you choose. So like you, I always say, yeah, just go take a nap or go to sleep. You can choose to make it look better after.
Yep.
And it's 67 years later and I'm still here. So it must work. It must work a little.
Yep. Yep. Definitely.
Oh,
Well, it was great chatting with you. It was so great chatting.
it was wonderful chatting with you.
Yeah. What a great platform this is too, and podcast.
Oh, perfect. Perfect. I really appreciate that. I want to say thank you to our audience. And I look forward to seeing you again next time. In the meantime, make the very best of your today, every day. And we'll see you again soon. Oh, things are falling apart here. That's so strange.
Thank you for listening. Please subscribe on your favorite service. Suicide Zen Forgiveness was brought to you by Truel Social Media, the digital integration specialists. Let them get you on page 1 in the search results.
And also by Canada's keynote humorist, Judy Croon, the motivational speaker, comedian, author, and stand-up coach at Second City. On the stage, Judy draws from her wealth of performance experience, wit, and insight to entertain, inform, and inspire in her dynamic keynotes and half-day workshops.